Hello, my name is Lubia Montese is with the talks about HIV epidemic controls, the insights from the test and the trials. Definitions. The epidemic helps with an study on the HIV/AIDS developed study de support decision based on sociocultural epidemiological evidence comparisons care for the detection, diagnosis, the control, and the treatment of the HIV. Static clinic conduce the health service a condition attention and the concurrent modus regulation in the condition includes to transiting and the technical evidence of the HIV and the health responsible for the extension and diagnosis and the clinical care work estimates that worldwide the population living with the HIV in the workers universe of the serial heart stat videos.
You may have heard the term HART referring to HIV treatment, but what exactly does that mean? Well, HART, which stands for Highly Active Antiretroviral Treatment, refers to the sort of modern-day present treatment regimen for treating HIV infections. And it's called highly active because compared to the previous treatment regimen, HART is just a lot more effective, and so the name just kind of stuck. So before we'd give just one type of drug to help control an HIV infection, we'd usually give an NRTI, which stops the reverse transcriptase step in infection of a CD4 cell. But, HIV likes to mutate a lot. So for one, we know that if your CD4 T cell count is less than about 350 to 500 cells per cubic millimeter of blood, then it's time to start HART. Remember, CD4 count is sort of used as a marker for how far along the illness is, right? The lower the CD4 count, the more damaged the immune system is. Viral load is important too. If the amount of HIV in
Application in nursing. The nursing must have the credible of the subject of the internet with the patient with the pathology and explains the patient and the families the rich have the news controls the hospital with the administration medicine and the contact of the material videos. Pros and cons. And the person with the has the opportunities acceso rápido on the test and the induce mujer and resultan de have oportunidad to tratamiento and education of the disease as the heart system implemented strategies to protect the population and fraud The problem is that the people refuse pharma the test on diagnosis cannot that the epidemic health services system and the Ministry of the Public Health the have fixed the costs, the medical construct and the treatment this the infection is the pathology. Videos.
Diseases aren't centered anymore. They're always traveling. Making a difference at the origin is always an improvement. This program is called the HIV STD Research Program. It's part of the Division of HIV and AIDS Prevention. From the CDC point of view, our relationship is with the Ministry of Health and really helping to build the capacity within the ministry and at the ministry sites. Part of our clinical trials experience here is a very specific type of accreditation that we have to go through and specific quality controls, specific methods in the laboratory that support those clinical trials. Some of what we do here, we will have people come and learn from us to help understand some of those systems and some accreditations. And epidemics are evolving. We have an HIV epidemic in the US. We need to learn more to effectively control it. We need to have sites all over the world that can understand if there's differences in HIV, if there's differences between populations, if there's differences in how drugs react in different populations and to prevent HIV. Having global sites really helps us to
And should apply in the Ecuador. The first cases HIV in Ecuador were detected estimated by the Ministerio de Salud Pública with technical support from science indicate that with the X where the people living HIV controls and the tissue the high groups bags and 15 and the most affected with epidemic with the greatest numbers of the cases in Mex, the HIV epidemic in Ecuador is the concentrates the types mainly the transgender warmer. Videos.
diagnosis and testing of HIV infection. Anyone can be infected with HIV, regardless of age, gender, or lifestyle. However, some individuals may be at greater risk of infection and should be tested for HIV, including anyone who has used or shared needles for injecting drugs, such as heroin. Anyone who has been diagnosed with or treated for illnesses such as hepatitis, tuberculosis or TB, or a sexually transmitted disease or STD. Anyone who has had unprotected sex. This includes cases where condom usage failed due to breaking or falling off. Testing should also be performed if unprotected sex has occurred with someone who meets any of the above criteria. HIV cannot be diagnosed through symptoms, since symptoms may be related to other illnesses. The only way to know if you have HIV is to take an HIV test. To diagnose whether you have been infected with HIV, a blood sample will have to be taken for testing. Tests performed on your blood sample will look for the virus itself, or specific markers, called antibodies, that indicate that the virus is present. Antibodies are special proteins produced by the body's immune system to fight infection when HIV enters the body. If a person has HIV-specific antibodies in their blood, it means they have been infected with HIV. HIV, the virus can be transmitted from mother to child during pregnancy, labor and delivery, and from breastfeeding. All babies born to mothers with HIV are therefore born with HIV antibodies, though not necessarily HIV itself. Infants born under these circumstances should be tested for HIV infection. You should speak to your doctor if you are worried that your baby might be infected.
conclusion, the administrative surveillance system looks for the strangest to the rich people infected with the HIV infection and the order the treat person was the area in the infection with the making educational time for the health prevention center the infection with the use of the preservative and the heart the single permitted performing examination to the very is the person that is negative or positive and the should gives the antiretroviral. Thank you.
Diagnosis and testing of HIV infection. Anyone can be infected with HIV, regardless of age, gender, or lifestyle. However, some individuals may be at greater risk of infection and should be tested for HIV.